My name's Jennifer Goldsack, and I was diagnosed with stage 3C colon cancer in right at the very beginning of January 2025. I'm the founder and CEO of an organization called the Digital Medicine Society, which is a global nonprofit that's really thinking about, as we digitize healthcare, one of the largest and most complex industries that really hasn't undergone sort of full-scale digitization. How do we do that in a way that returns to the very patients that our industry exists to serve? And that is a career that follows, the best part of, 10 plus years working in healthcare innovation. And before that, I was an Olympian. I actually came to the US, despite the accent, I was born in the UK, to compete for the United States in the 2008 Olympic Games. That was an extraordinary experience. Since then have really been taking all of that energy and focus and sort of relentless dedication to a cause into health innovation. And so it wasn't lost on me when I got such an advanced, such a complex diagnosis, that I was now living so many of the challenges that I had been trying through my professional career to work to support patients through those moments, to work to create a healthcare environment where the kind of pretty close to catastrophic and late diagnosis that I received myself wasn't something that actually happened to people. And it really has put, over the course of the last 15 months or so much into contrast for me. Someone who had a career where I relied entirely on the high performance of my body, for my body to let me down and to be frail, and to feel so unfamiliar in my own skin. And for someone who spent and continues to spend so long advocating for better ways for caring for people, what a reminder of the extraordinary people who hold a pretty broken system together every single day with just a white-knuckled grip to make sure that we are cared for. The whole thing has been absolutely extraordinary and has challenged me and brought parts of me together in a way that I never could have envisaged. A lot of it has actually been me using work and the mission-oriented nature of what I do as, frankly, a coping mechanism. When I see something that is so incredibly broken in the system, where I see physicians, nurses, techs, folks in the billing office just working so much harder than they should have to in order to do simple things to care for us as patients. On days where I'm well enough, I try and work to build a system and promote a system and advocate for a system that is functional, not just for patients, but also for providers. I have never once felt alone in this. It's also, again, made me realize how incredibly privileged I am to have that network. And a lot of people don't have that support network, or they are so far from the nurses and from the brilliant individuals who put hands on them and care for them every time they set foot into the clinic, or for the month plus like I spent in the hospital. This is not something I take for granted, but yet I firmly believe it's something that everyone deserves. And what are we doing as a community? What are we doing as an industry? What are we doing as a society to make sure that the experience that I have had, one that has helped me cope and one that has saved my life, is not one that is exclusive to folks who are lucky. I think for anyone who doesn't yet meet screening guidelines, I would add it is so important for us to not dismiss symptoms that are persistent over time. With the benefit of hindsight, I feel so silly that I didn't go for help sooner. I'm not blaming myself. I've got over that part. But, for me to have been the person who was so full of energy, the Olympic athlete for decades and decades, to be like going to conferences with like a purse full of multiple Red Bulls just to get through the day and be able to function for months. That is not normal for someone who has always had a great diet and a healthy appetite to have had like the stomach issues that I had for 6-8 months and to have just ignored them and be like, oh, well, you read all of these things about like green juice and everyone's got stomach cramps and just move along. Like, we can't ignore those symptoms to get like multiple times turned around from the blood bank because your iron is too low and to do nothing about it. Because we're busy and because we're all pressured, we have to respect ourselves and our bodies enough to know. And I think as a society, we have to get better at recognizing when, you know, symptoms actually should be addressed by going to the doctors. And the other thing I know to be true is I know a lot of people are reticent and are nervous or maybe uncomfortable with something like a colonoscopy if you are eligible for those screening guidelines. I think the one thing that I would say is if that makes you nervous and if that makes you uncomfortable, come sit next to me for 5 minutes and let me tell you a little something about what the treatment looks like if you miss it. There is absolutely nothing that could prepare you for what your body goes through. And if you have the opportunity to get access to a colonoscopy, which could catch something early, it's even in that moment, you know, you can remove polyps. Like it's just such a powerful test. The screening is available, and I would encourage anyone, you know, I know it's hard to find time. I know that the reality of going to a clinic, you know, the prep isn't fun. All of those things are true, but value yourself enough to know that this is an increasingly prevalent disease, that you deserve carving out the time to go and get the screening.